Hey, here we go. All right. So welcome today to Enhanced Community Assessment. We're going to be looking specifically into a community strengths and needs assessment that we promote here at Cal Kappa. My name is Lawrence Heiner. I'm the Director of Training and Technical Assistance at Cal Kappa. And today on the call, we've got a few from our organization. David, do you want to come off of mute and say a few words?
Yeah, thanks, Lawrence. I appreciate it. Just great to see everybody's face. Thank you guys for being here. Obviously, we're rolling in to a needs assessment a cap year. So I appreciate Lawrence putting this together to kind of look at how do we take the next step from the leadership role to enhance this. So great to see you all. As Lawrence said, I'm also glad that maybe the heat is starting to break. So we're glad to get back to more normal weather. So thanks for being here, and I look forward to listening along with everybody else.
Thanks, David. David's taught me pretty much everything I know about community needs assessments. So if he chimes in from time to time, please welcome his wisdom. But I'd like to get us kicked off here first with a couple of our learning outcomes that we expect today. In brief, we're looking to identify a practical model for conducting an enhanced assessment of agency, family, and community needs. And then we'll also be using the community strengths and needs assessment outline to ensure comprehensive CNA for planning. So I'll go into both of those. And to kick off this first part, I'd like to look at the CNA from a kind of an FAQ sort of perspective. What are the top things that we need to know as leaders as we get into the community needs assessment process? We know that it's required, but why is that, and what's some of the information around that? So first thing is, what is a community needs assessment? In the organizational standards, we know that there is a community assessment that's required. The CNA has come up as sort of a jargon within the Community Action Network to identify that initial phase of assessment in our community to understand what's happening so we can address the issues that are affecting the community, prioritize needs, and develop strategies to address them. So why is it that we conduct a CNA? Well, one, it's a legal requirement. So as I mentioned a moment ago, it's outlined in the in the organizational standards that we perform a community assessment. And then it's further illustrated in our community action plan process. It is also core to community action. So as part of our DNA as community action, the community needs assessment is sort of a starting point for understanding what community needs are. And that is embodied by the things that we do. It also illustrates the local control aspect of community action. We're data-driven in our decision-making processes, and this is one of those first steps in securing data so we can start matching up our effectiveness against the needs that we see at the beginning of the community action planning cycle. And then accountability. So this gives us a level of accountability, gives us a measuring stick to say whether or not we're affecting change in the community by understanding exactly where they are today, right? Or at the time that we perform the analysis. So what does it mean for this assessment to be enhanced? Well, you can do a bare minimum for a community needs assessment, just outlining a few areas and submit that, and there's no one that's going to tell you that it's necessarily wrong. When we look into enhancing our community needs assessment, we're digging in and we're understanding what the real situation is for our community, the clients that we serve, and then the clients that our future clients, I'll call them, people that maybe we don't serve yet. All right. And then how the rest of the community factors into that. So it's not just the folks that we are assisting that we're concerned with. We're also concerned with a number of other things. So when we analyze multiple data sources, we're looking at not just the raw data that we secure, but we're also looking at existing metrics and other resource documentation that we can use to inform our analysis. We'll consider strengths and needs. So though we call it a community needs assessment, that's the common vernacular here, a CNA, we will slip in this idea of strengths as well as needs to identify the strengths of the organization, strengths of the community, and to call that out so that we know where we have solid footing in the community. We'll take a look at our geographical analysis, looking at the actual spaces, the geographies that we cover with our services, and how they may or may not overlap with other agency services or other programs that can assist our client base. We'll take a look at trend analysis. So this is a very important thing to do, looking back at historical data so that we can see if programs are working or not working, if they should be changed or not changed. Hint, they'll probably be changed. I mean, we're looking at trends to see what we can do to better affect our community. And then another enhancement is engaging stakeholders. I mean, at minimum, we're looking at the staff, our clients, and our board, but who else do we involve in this community needs process? Are we reaching out into the community to look for other leadership and other important members of our community to assist us in this process of understanding what the needs are of the community? Okay. Now, these areas should look pretty familiar, and I'll reference these again later. But some of the key data points that we include in the CNA are demographics. I mean, we discussed that just a moment ago, but digging into demographics and identifying what kinds of things we're recording. A lot of that is going to be because our funders need it. Other things are going to be because we feel that collecting this kind of demographic information will help us make better decisions as an organization on where to put our resources. Housing is going to be a big deal. Understanding who are the players in housing in our community, how are we cooperating with those existing players, and then where are the gaps, in housing. So understanding that in its entirety. Education. So we're identifying kind of levels of education within the community where there are opportunities. What does childhood education look like in the community? Where are there gaps and opportunities? And then how does continuing education look, and the ability for better employment and so forth, which leads to employment, right? So employment, we're identifying what the employment rates are internally, what types of jobs are available in the community, and what do those pay? And then are there transportation barriers to getting to the jobs from where people live? Health is an increasing area of concern and opportunity for all of the agencies, particularly with new statewide funding programs that center around health. So we want to know what the access to healthcare looks like, who all are enrolled in Medi-Cal in the area. The prevalence of chronic diseases, things like asthma are a big deal right now because that's part of the CalAIM package. But what other chronic diseases are prevalent as funding sources come on to address them? And then health insurance coverage itself. So I mentioned Medi-Cal, but what else about health insurance is affecting the local community or access to it? Childcare by itself obviously is important. We want to see what's the availability of childcare, how affordable is it? What's the quality of childcare services? Are we looking at just kind of daycare, or is this an educational experience for children as they get started? Clearly, this is going to be of interest to Head Start programs, but it certainly goes beyond that. I understand that one of the largest statewide programs that many agencies operate is in and around early childhood education, including or included in that child care category. And then lastly, transportation. Having access to reliable transportation, and what does reliability look like to your community? That's going to be very different in city centers than it is to rural areas, and anywhere in between, right? So how are we affecting transportation, and how does that relate to the other areas that we're affecting in our community? All right. So how should a CAA analyze and interpret the data that we collect? Well, a couple of ways, 4 ways here. Firstly, we want to identify trends and patterns, whether that's in our demographics, whether it's in the needs. It could also look like who is utilizing services, and then comparing that across things like geographies, and any other notable trends that we can see through the data. Trend analysis is actually one of those important parts of looking through data, and knowing which data sets to put against one another. When you start to overlay things like transportation to where the available jobs are, say, you start to notice where the gaps are, or where they could be, and how to address them. You also want to look at comparing different data sources, and we've got some tools that do a lot of that analysis for us. But as we look at the tools, we'll start to scratch our head and say, hey, where can I get some additional data in and around particular topics? Like maybe it's a deeper dive into demographics, or what's available in employment, say, right? So we may need to dig around a little bit for data sources, but it's important to compare them and make sure that we're doing an apples to apples type comparison, meaning that the data that we're comparing, it's talking about the same thing. There's a strong national push right now to sort of standardize the language around that. They call it data interoperability, so that when we're recording data in our systems, that the data that we're taking out of them, the terminology that's being used matches what we expect it to match, right? As you look into your data systems, you'll probably find that things are called different things depending on which data system is recording them. So eligibility, for instance, may have a lot of different definitions for how data is captured, and you want to make sure that you're looking at common data for those eligibility standards. We'll have a focus on outcomes, and this as opposed to outputs, right? So when we're looking at analyzing the data that we're collecting, we want to see what kinds of changes that our programs may be able to affect, right? So looking and seeing if programs are affecting outcomes in the organization, in the community, could be in the organization, actually. So if you've got agency-wide programs that you're trying to maybe onboard a new program or something like that, you may have agency outcomes that you're focusing on. But in general, you want to ensure that you're able to report out the outcomes. So when you're doing your initial analysis, keeping that in mind, what can change? What do we expect to change? What do we not want to change, right? What do we want to stabilize is another way to look at that too. And then considering the geographic distribution. So, when you start to map out where services are, where people are, where the need is, when you're looking geographically, that can start to be very telling, especially in much larger counties, or larger service areas. Some of you are operating in way more than one county. So seeing that geographic distribution is very important for aligning your services the way that makes the most sense, given your resources. Right. Number 6, how does the community needs assessment inform the development of the community action plan? This is a big, big deal. In fact, it's one of your core activities in planning out the community action plan. So you need to have you'll use the CNA to help identify your priorities. As part of the community action process, you're going to be listing or reordering the needs in terms of the community's priority or the priority that you can affect them. And a lot goes into that. So it's how important is the need to the community? How available are the resources? Who's available to address those needs, et cetera. The CNA is going to inform your program design because that's going to identify for you demographically who will be part of those programs, who is intended to be served by those programs and how they'll be recorded. You'll have, very importantly, is justification for funding. You'll have the numbers behind you that spell out the need. And especially when you can look year over year and you can start to identify the return on investment for those services. That's very helpful when you're justifying whether funding is working or not. In general, your analysis of the community is going to help you for justifying funding. And you may find that you're partnering with other organizations while you're doing this community assessment process. And to a greater or lesser degree, a lot of this is to justify the funding that we receive and that we ask for, right? So when you're able to demonstrate that there's more need than you have funding for, you're in a better position to ask for more dollars. And then lastly, measuring success, which is kind of related to the funding question. People want to fund successful programs, whether they're ones that you have been demonstrating for years or they are ones that are something that you want to bring on board at your agency, but there's demonstrated success somewhere else. You can use those other reports. So if you're demonstrating success today, it may serve more than just your agency. Your successes may be able to inform programming at other agencies as well, based on how you've operated it and recorded it. All right. And then what role do community partnerships play in the CNA? One is that you can leverage existing resources. So there's no need to bring on a whole new program if someone else is already doing it and you can partner with that other organization. If capacity is an issue, then you can explore expanding it, but when there are available resources, partnerships are key. Gaining diverse perspectives. So when you're able to bring in multiple groups into the conversation, you start to see things outside of the agency's eye. So learning those other perspectives from other groups gives you an opportunity to see where gaps may exist or where new partnerships may be available. And then lastly, in enhancing outreach. So as we start to talk about difficult to reach populations and the reasons why they're difficult to reach. So I'm reminded of reaching out to groups with language barriers. There are some common languages that we translate a lot of our literature into, particularly Spanish, sometimes additional languages given our city centers. I think in Fresno, you would see a multitude of languages. Actually, I remember them, even Hmong, as a language to translate information and marketing and outreach information in. As we engage with community partners, we start to see more of those areas where we don't have a relationship with that community. So we're not hearing their message just yet. Those community partners give us a way to reach that community in a like a comfortable, familiar kind of a way. Okay. And then the last question is, how can a community action agency ensure that its community needs assessment leads to meaningful change? Well, that's what the rest of the planning and the performance management process is about. So the CNA allows you to present your findings very clearly, succinctly. We're about to go into the model for that. So I'll show you exactly how we would recommend doing that. But that CNA does give you the specifics so you can track it back. It's similar to that accountability. We'll develop actionable recommendations. Okay, so through this process, as we understand what the need is, and if you remember your Roma training, then we take that need and we're looking for an outcome, right? We want to be able to affect those needs, and that gives us our marching orders. That helps us to develop those actionable recommendations. It kicks us off with tracking progress and evaluation, right? So we kind of need to know about the community in order to tell whether or not our programs are making an impact, and then evaluating the data set that we have and tracking that progress so that we understand if we are on the right track or if we need to make corrections along the way. And then maintaining ongoing engagement with our partners that we've connected with the community, with the key stakeholders for community action in our local area. This process helps us to reach back out from time to time on our schedule every couple of years, every 2 years, to re-engage and understand what's happening. So, thinking past the survey, we're going in and having conversations with our community, focused conversations in our community with a plan to move forward. Okay. All right, I'll pause right there. We're about to get into a 3-page outline that I'm going to distribute after the call. But before I do, I wanted to pause to see if there were any questions about that first section and the what is a community needs assessment. Okay. Well, hearing none, let's check out the template. All right. Some of you may have seen this before. It's a tool that we have been promoting for a few years now, that takes pretty much every component of a community strengths and needs assessment and puts it into an outline format so that you can essentially use this tool to build a complete, comprehensive community strengths and needs assessment. Right. So if you follow this one all the way through, we would argue that you've got a pretty solid tool there that you can take to your stakeholders and funders to demonstrate the needs of the community and the strengths of your agency and the community as it stands at the time that you do the analysis. Okay. First part, very simply, is an introduction and the methodology, but you want to make this very clear because it's important to those folks that are reading the report, how it is that you came up with the report. Okay, so your methodology can kind of make or break you before anybody reads one data point. Okay, so a couple of things to include in this section is like who participates in the community needs assessment, right? So here's a short list of folks that can participate in the needs assessment. You definitely want the agency and the agency board. You'll be interviewing either through a survey or in other methods like focus groups, existing clients or customers. You'll have intact communities, meaning like community groups as part of your larger geography that are part of the assessment process. So reaching out and developing those partnerships with them. Accessing difficult to reach populations and making that a point. So identifying is one thing, and then finding effective ways to reach out is another. So whether that's difficult to reach due to communication or geography or some other thing, trust is a big deal too. So identifying ways to build trust with difficult to reach populations can help include them in the assessment. Local employers, local educational institutions, and faith-based groups are also great sources of connection and outreach. And then you may also have contracted CNA outreach and contracted analysis. Those things can come through too. Kind of depends on the scope of your needs assessment. we'll do our best at the association level to provide you with what you need to do this in-house, right? That would be our hope, that everybody can reach that as a goal. And then we also recognize the reality is that that doesn't always come to pass. So we may want to understand how to engage with those contracted partners for the CNA process, though they are not there after the fact when you all are doing the work and recording the information and reporting it all out. Okay. So making sure that you've got a solid assessment and understand how it came about. Okay. We'll open this up. Who else would you consider important to participate in the community assessment that's not on this list?
Maybe focus groups.
Okay.
Can you do volunteers?
Oh, there you go. Volunteers. Yep, volunteers. That's a good one. I thought I'd open it up. You know, we all do a lot of needs analyses out there. So bringing in other groups, really important. And establishing that on the outset, right, is a good first order of business. Incidentally, folks from these groups will often make up a community assessment committee or CNA committee of sorts. A lot of times I've seen that done by the board to pull that together. Sometimes it's done internally, but bringing other folks into that is your prerogative. All right, and then discussing methodology. Here are a few of the methods. Heard focus groups just a second ago, so that's a great method of collecting data. So consider these your data collection sources and activities. This makes up your method, and this is going to be interesting to the folks that are reading your community action plan for how it is you came up with the needs, right? So we look at program data review is always a good start. Looking back at your existing programs, seeing what data you have on those, and incorporating that into the assessment. With that annual report data, so it's recorded there. Any business partner outreach. So especially if you're looking out and seeing kind of what jobs are available these days or other opportunities with local business partners. The CAP Data Hub assessment tool is almost magic. And this is something that is accessible for free to all community action agencies that will give you a really good demographic look of any service area in the country. So you customize it by your service area, by the zip codes, or other geographic markers, and it will provide for you information in most of the areas that you're concerned with. Okay. So with a little time, I'll demonstrate that tool at the end of the call here. And then local business canvassing is important. Participating in community town hall meetings, community member survey, and then focus groups, you know, at the end. So the survey is important, but it is one of so many data sources that we want to include in this analysis. Okay, so let's dig into a couple of, well, all the areas here. We'll do a quick review of what's going on in the outline. So the first, the large chunk is the service area data, right? So we kick things off in service area with demographic data. So we're gonna report on we'll include in our analysis the service area quantitative data that can be in the census charts. This is quantitative with the that's with service area, and then we've got the customer served quantitative data. So these are your number counts, right? How many people you've served, what kind of service areas are you covering, right? So you want to know who's the largest customer base, like what makes up your clientele, right? What's the demographic breakdown there? And then what types of programs and services are really needed in that service area. Okay. Now it's looking only at the demographic data, as opposed to looking at other feedback from the community. For geographic data, you remember these categories from earlier. For the geographic data, we can start by looking at the poverty population by census tract and the maps. That's available in the engagement tool. That's where you're going to find a lot of that information, so you don't have to track it down yourself. It's provided in that assessment tool. So you can start there to know, at least according to the last available data, which is not necessarily every 10 years with the census. It's updated periodically with additional data sets. The tool that we recommend, and that's available to CAPS. We'll need to know what our housing supply looks like. A lot of the stuff that I mentioned in the FAQ. So the housing, the available stock, not in stock, what's typical living situations for your communities. In education, where are the schools compared to where the neighborhoods are? What's the level of education based on whatever statistics you can find on the quality of education, and what that means to you. You know, are kids graduating? Are they moving on directly into career work? Are they moving on to college? So understanding what the education landscape looks like is important. Employment, so not just what's available, but how long are people able to hold those jobs, and how far away are they from living or community centers? Nutrition was not on our previous one, I don't think. So this is your access to food banks, grocery stores, and so forth. So this is going to start informing not just what individuals need, but what communities have access to. So when you're looking at nutrition, you're also looking at what qualifies as a food desert, or where are the food banks, and are they close to areas where people may be able to access them when they're in need. Congregate meal locations, you would factor that in as well. And a new one on here that I need to update my slide. But when thinking about CalAIM, there are additional nutrition components that can enable CalAIM services. So nutritional, oops, I'm going to get this wrong. Specifically prescribed nutritional meals by a doctor. There's specific funding for that. So it may be that your agency intends to or wants to participate in something like that. This is where you would identify the need. Childcare, spoke on that just a moment ago, but where are those centers located? What kinds of education are offered? Is there pre-K, TK? Are childcare vouchers an option in your area? For health, where are the hospitals? Where are the specialty services located? Think also outside of general care, and think also about dentistry and vision. A lot of times those are mobile centers, that sort of thing. And then transportation. Does public transportation get to each community? You know, where are the gaps in those lines? It may be a very valuable effort on the agency's part to just have a bus line created to go to a community. Heck, a bus stop, if it's necessary, and it can increase outcomes for your folks. But knowing what the existing transportation system looks like is really important. What's available to you. All right. So after you've identified all of the pieces and components, then you do your analysis on what's going on with the geographic data. So you will ask questions like what do the populations say versus what do the partners say is a top need? Maybe some discrepancies there, you know, as you start to look at what people are saying that they need versus what maybe city council thinks is needed or something like that. Okay. What services are people receiving when they provide research? Is there any correlation? So what services are people engaged in at the time that you're doing your study? Are there any correlations between the services that they're participating in and the outcomes that you may or may not see? Are there any correlations between what they're doing now and what they could be doing in the near future if you had additional services available, right? Or enrolled them in existing services they may not be enrolled in. What gaps exist in ensuring maximum feasible participation and input? So you remember those hard to reach places or hard to reach populations? That's a part of this. How else can you encourage maximum feasible participation in the study that you're doing? So that's within the low income community, but that's also in our stakeholder community as well. So don't forget about those folks that are out there that help us meet the needs, right? I always think about employers because we do so much around employment and what's available and what does quality employment mean for our clients. What's their goal? Like what are they on track to, and do they have access to it? And then what opinion gathering systems have challenges? So like so when we are reaching out and trying to get information from these populations, are we not able to hear them out because there's some barrier between somebody participating in a town hall or some other focus group due to mobility, say, or maybe the distance that's involved to get to those and participate? So how are we addressing those challenges to encouraging people to come in? What have we done to do that, to meet those challenges? Okay. Additional in the service area, we're looking at the trends. So we want to see, even if this is the first year you're looking into some particular kind of a service idea. I think about CalAIM a lot because a lot of agencies are bringing on services with CalAIM, but it could be anything. You'll want to look and see how much historical data you can find to prove the need in your area, and then also to see how we can improve services to the community. So you can look at 1-year comparisons up to a 3-year comparison. They tell you different stories. You know, year over year versus 3-year can tell you very different stories. You'll analyze these and then provide some projections. I think we're up toward the end of service area. Yeah, for quantitative and qualitative analysis. David, I wanted to pick your brain for just a second, if you don't mind, because you've done a couple of these. So what are some of the top concerns that you think are necessary for folks to consider when grabbing service area data, speaking to the community?
Yeah, appreciate it. So I was glad to see you hitting the other slides first, and what some of the biggest gaps that we see is that we kind of bring up the same survey every single year, right? We go in and say, well, these are the questions, like, what are your top priorities? Well, that kind of language is very internal to community action or to CBOs in general versus what you're trying to specifically ask. And we have to remember that a needs assessment, and especially on the survey part of it, it doesn't work in a vacuum. It works based on all the years of information that you've had. You know, we do this every couple of years, and we all know that a majority of those things haven't changed within 2 years, right? There's a slight change every so often, but nothing that's typically really drastic. And sometimes some of those questions will ask very general statements around what are your top priorities, or what is your issue with this priority or that priority? And it doesn't really match the question, whereas you could get a lot more tangible data, tangible information when you really start to narrow down what your surveys are based on the study of your service area and based on the study of the customers that you've been seeing. And so some of those questions can be formulated very, very specifically based on if you identify a certain age group that is very, very particular to who you serve. So if the majority of your individuals that are in poverty in your community are between the ages of 18 and 25, and they have a high school diploma, but they don't have anything else, well, those questions may be formed a little bit different as to specifically what you're trying to ask. And it's okay that every question that you ask doesn't necessarily fit somebody, but an example would be in that you may say, if you currently have a high school diploma but don't have any advanced any education, you know, what do you feel is keeping you from returning to school? And then it could be all sorts of things like, well, I don't have any access to childcare, right? We hear that because there's not a child care facility, and you can lead off of those questions, especially using, think tools like SurveyMonkey. It says if somebody answers it this way, then I can ask this additional question versus this. So really mapping how your questions are versus making them just so basic as to this is exactly what I'm asking every time. So you're always trying to dive down into being very specific. It can also guide where you want to ask questions and what certain group of individuals need to have maybe different questions that you want to ask. And again, I know that can be somewhat difficult because you're trying to get somewhat general information. But one of the things we laugh about all the time is what's going to be the number one need that everybody picks out on every survey, pretty much in every location across the state. They're going to say housing, right? It's going to be some form of housing every time. We know that, and we know that it's a community level issue majority of the time. There's a lack of affordable housing, right? But how many of our agencies really are able to invest, just not that we're not doing it, but just a ton of money into really producing, you know, affordable housing at the level in which we would probably need to get there. Doesn't mean we don't partner, doesn't mean we don't try to do that. So if you have that information, and I think that's very crucial, is that a lot of times we say, well, we don't want to have bias in information. Yeah, but you do have to work off assumptions, and each one of you are the most intelligent, you know, person around poverty in your communities, because that's what you do every single day. So you want to use some of that knowledge, some of that information that you have from 2 years ago to help relook at that and compare that to exactly how you're gathering that information. It also changes how you're able to get feedback. And one of those two ways I want to talk about on this is being able to use that service area data, and you're looking through that to figure out what other questions do we not have answers to yet. I also always suggest people, as you're starting to gather this information, that you really look at the way you form those questions. A lot of times our questions in our gathering system is always typically trying to look at where the gaps are, where the needs are, but also constantly trying to make sure that you focus on the strengths and asking those type of questions and gathering that type of data, because you're also trying to tell that part of the story. And I know if you go all the way back to the CSBG law, it's written in a way that's kind of negative. You know, it says, what are the causes? What are the conditions of poverty, right? That you are trying to identify, but it doesn't mean that you can't name that these other strengths are here, and how can we use those strengths to overcome some of those needs. So that's what you really want us to be able to look at. On this first topic here that's up on the screen now, I think it's very, very valuable in understanding strengths and needs, or using strengths, or using our current networks to form where we're at. Give you guys an example. When I was in Mississippi, we did a survey once that went out, and of course, we're gathering all this information. We're looking at our data, and our population was just what I said. It was 18 to 24-year-olds. They had a high school diploma. They typically had 2 kids. Most of them had a job, and most of them claimed that certain cost of housing and certain costs of childcare and the ability to progress was their biggest issue. Then we went out and surveyed Partners Alone and had a separate survey for them. What was really fascinating is the majority of our partners said it was income management. So we realized as the community action agency that part of our plan, part of an agency level need was formulating groups so that we could help better educate a lot of the partners that we work that it may not be income management if there's no income to manage. So, part of that is we can come off the assumptions of that, but we had hard data to show, and we really went in and showed that to our partners to say, we're not picking on anybody, but this is a response we got from a lot of folks that they believe that if people knew how to manage their income better, that we would have people with better opportunities. But when we go over and say, well, here's our surveys, here's the actual data of what it is, and be able to really produce hard facts into what level of income people were at, and then go over and show them what an average, cost of living would be in this community, that the income, no matter how great they were at managing their income, it still was not there. And so if we could get them to help us focus, that helped start changing a lot of policies. It started changing procedures. And so we were able to write that in our plan. That part of our plan was to increase the procedures of getting certain social services to not always include this mass amount of income management needs. So the other ones on here I want to talk about too is when we talk about what services are people receiving when they provide research. So what you see a lot of times is you take these surveys into your Head Start Center, right? And what happens there? Everybody says we need childcare. You take it into the Senior Center, everybody says we need senior socialization activities. Or my favorite we used to get is we need more trips to the casino. And I was like, hey, that's probably because of where we're asking. I get it. What you mean is we need more entertainment. We're probably not in our line of business, but that all jokes aside, like it was really who you're asking, where you're asking at. And it may be more beneficial to, again, not use a general survey, but try to dig down into those separate populations and record that separately and compare those different groups and analyze that. But a lot of that comes out of first knowing our service area. So it may be different questions when you're talking about your elderly or individuals on disability that are on a fixed income. They're only worried about lowering cost, right? Versus when you're working with other individuals that may be trying to move up the economic ladder, and so they have different social supports they're looking for, versus maybe having specific questions for your unhoused population or individuals that live on the streets. And so those are different questions, right? And so that's what happens. The other thing is about ensuring that maximum feasible participation. I always go back to challenge folks to look at how you're gathering that information, and that you're presenting that in a fact that two things is we want to take what our strengths are and understand where our gaps are. But the other piece is when you communicate out about getting surveys, is really releasing that power of explaining to folks what CSBG is, what community action is, and that they're helping build part of this plan. This is their chance to offer their opinion. There's other ways to do that, to participate in what we do, whether it's volunteering, it's being on boards, being on committees, all that. But this is really their chance. And this sets the plan for us for at least the next 2 years. And one of the ways we used to get a lot of feedback, we'd say, well, if we don't have people at this event, or individuals don't share this information, we're going to gather as much data as we can. But if enough people don't say this is important, then we're not going to be able to focus on that. So don't come to us in a year and a half from now and say, "Why we're not spending money on this?" But we took as much feedback as we could get. We created as many opportunities as possible. So, so that's really understanding that, and to understand that there's not just one method, right? Whether it be putting ways to gather information through social media, through regular means of media, through all different types of ways. It's how you pose that question about, this is your chance to help us build our service categories, or this is your chance to help us identify what we can be doing better. So it's just kind of opening up that opportunity. So thanks, Lawrence.
Okay, thank you, David. Yeah, and we've got a few minutes left, and the balance of the outline, I'm going to go over a couple of slides here that show you what's included in it. The balance of the outline is looking into things like our existing systems data, for instance, which is your essentially a lot of your outputs that you record in your data systems. So like the total number of families, the total number of individuals. Some of this may be calculated, and part of this is in terms of the dreaded deduplicating your counts activity. But in this case, what we do want to look at is all the system data so that we know what it is that we're working with. David, do you have a thought?
Yeah, it's really, you said this earlier, it's trying to find out where that trend is. So if we had 2,000 students in our Head Start, if out of those 2,000 students, and we measured, what their kindergarten readiness was at the beginning and at the end, and if we had ones that had major growth and ones that didn't, what we're looking for is there a telling factor? Is it the parents are engaged in education themselves versus ones that aren't? But then we would see value in that result and be able to really drill down what that is. But it's also looking at what are the common gaps from everybody that presents to us. So if we had something major like a food bank, and you have a way to say, I simply want to know what are your current levels of need in these 10 primary areas. Well, if there's a common factor, that really shows this is who folks are, that's very, very valuable. But it's more about you run certain programs, and even if you don't have it agency-wide, take one or two programs, try that, really dive into hey, we have this small program that's only serves 100 people. Try to identify the difference in folks that had an outcome and folks that didn't have a strong outcome, and see if there's anything. And then you can use that and say, this is a focus group that we really looked at in this specific program, and we identified that these folks all lacked X, and that's very powerful.
All right. Cool. And David, you probably discussed just a few of these items already in the analysis of that stuff, but yeah, absolutely. Using that trend data. The next thing, and I spoke on this just a little bit a moment ago, but looking at community assets. So remembering that this is strengths and needs. What's out there? What's out there in the community right now that we should take note of? Talked about housing. So what's existing? What opportunities are there? Developments that are shovel ready or actually being built? Education, the school locations and so forth. With employment, I touched on that a few times, especially reaching out to your employment partners, but what jobs are available? Where are they? What kind of development opportunities are part of that? You've got nutrition, so you've got your food banks around. What existing grocery stores, where are they? Are there places where you have congregate meal centers? Is there a food stamp office, but do people have access to signing up for CalFresh or other food services? For childcare, where is the childcare available? Right? Are those in the neighborhood? Are they centers? Are they, near work, near school? Those sorts of location-based, or the quality of childcare and how much or how accessible is quality childcare. For health, obviously, where hospitals are and knowing the assets for existing health partnerships and referrals is important. I mentioned CalAIM a couple of times on this call for good reason. There's a lot of resources available to CAPS that are performing these healthcare related activities. So understanding the current climate and what's going on in your community in and around health concerns and quality of life there. And then transportation providers, what's accessible? Are there unique transportation providers that may align with your client base, public transit, and others? And then some analysis on that. So David, additional ideas on the community assets? I mean, are there other community partners? That pretty much it?
Yeah, and I always challenge folks to look at your referral system. And so if you refer out, how many of those referrals get met? First step, how many of those actually have outcomes? So if I'm not the workforce agency, but I partner with them and I've sent 1,000 people over there and 10 have success, then it's also examining that versus, you know, if 30% of them have success, and that's pretty good, then I better understand as to what the gaps are. And so that may be part of your steps as well, as going out and really looking at, you know, the fact that, oh, we refer this as a partner, but yeah, but is it a successful partnership? Are you getting the results you need? And the second thing you hit on, which is, in fact, just mapping those communities. Once you do it, you talked about a geographic study. You can map out very specifically what communities have the highest concentrated portion of poverty. You know, look at it. Do they have access to a grocery store? Do they have access to a health center? Can they get there? Realistically, can they get there if they don't have a mode of transportation? And so being able to really articulate, hey, we're going to get you on Medicaid. Well, that's great. If I don't have anywhere to go to use it, it doesn't matter, right? So really pinpointing that story out, painting the picture.
All right. And that brings us up to a conclusion. So in your conclusion, you're going to want to include your causes and conditions of poverty as you see them evidenced in your neighborhood or in your community. Looking at existing unmet needs, and recognizing that you're looking at all three of these categories of family, community, and agency levels for those needs. And then selecting the top, I mean, this is the prioritization part. So that's, and then leads directly into your community action plan, where you spell out how it is you're going to meet those priorities. And we are very much at the end of our hour, folks. So today, what we were hoping to do was identify a practical model of conducting an enhanced assessment of your agency, family, and community needs, and looking through that outline. So I hope that we did our job today for you all. Please let us know how we did and how we could be better in these and other training and technical assistance offers as we look into next year. As you all are completing that quick survey, I'll stay on here past the hour for anybody who has questions or maybe comments about their own community needs assessment.